All right, Rachel, first we are turning to a very serious subject, something a lot of couples deal with when trying to start a family. Talking about the loss of a pregnancy, it can be a very traumatic event, but there are some things to keep in mind to help cope with that loss. Dr. Joseph Adashek with Desert Perinatal Associates joins us this morning. Doctor, great to see you.
Nice to see you.
This is a very difficult thing for families to deal with. What are some of the things to keep in mind after a pregnancy is lost?
Well, sure. So we have a practice that just specializes in high-risk pregnancies only. So typically, you know, if a patient goes to the hospital, it's a nice normal pregnancy, and they go, say, in labor, and then there's no heartbeat of the baby, terribly devastating, obviously. So typically the OB/GYN doctors would call us in, and first thing we do is tell them there's nothing that they did to cause this. It happens, unfortunately, but you know, there's nothing they can do to cause this.
And so really, you recommend that, as part of the counseling that I imagine would happen afterwards, is to let the couple know that they shouldn't think that they shouldn't have tried to have a baby.
Right? No, absolutely not. And almost always they can have a nice, healthy baby again for the next pregnancy. Sometimes we can find out a reason and why it happened, whether it's something with the baby or the mom. But the first thing we say is you'll be able to have a healthy baby. And use all your family and friends for support, because this is a hard thing. You don't need to go through it on your own.
And that's what you also share the loss. I mean, it's something that you need to talk through. There's emotions that are tied to this.
Definitely. Well, it's probably the hardest thing a woman could go through is the loss of a child, a baby, and you know they have all their family and friends are expecting a phone call from the hospital with a healthy baby, and then unfortunately there isn't any. So that's what we're called in for, to help them out, to help them with the grieving process, and to find out medically what's going on, which goes to the reason that I'm here today. Is there's a new charity called Jalen's Gift, and what we do, and I'm medical director with that, is help them have keepsakes in the hospital, like blankets and things for footprints of the baby and pictures. And believe it or not, they have to have a burial, and to help pay for that, this charity will do.
And that is a great thing, because you say that you really should memorialize the child, because that is your child.
Right. You know, we strongly encourage they name the baby. Sometimes they're like, I don't want to see the baby, I don't want to name the baby. But always, when they've named the baby, they've taken pictures of the baby, then they end up, it's a real child who lived. And that's what this organization does, is help them figure out how to cope with it, give them keepsakes, give them things to help them forever, that this was a child that had a life.
And for people who may have gone through a loss like this, or just want to help out the foundation, there's an event tonight.
Right, so it's at 6 p.m. tonight. It's at the place,
park at Green Valley
Yeah,
Ranch.
That's it, yeah, I'm sorry about that. I live in Summerlin, so it's kind of far away. But it's a kickoff event for this charity, and we're going to have a Health Plan of Nevada is going to give a large donation to kick it off with, and it's going to be a nice, happy event. I know it's a sad cause. Of course, most causes are sad causes, but it's going to be for kids and balloons, and it's going to be fantastic.
Well, certainly a good organization doing good work, and having the appropriate resources available for people who need it. Doctor, thank you so much for your time.
My pleasure. Thank you for having me.
Appreciate it. Rachel, back to you.
All right, some great tips. Thank you so much, guys. Well, a battle